Have you ever really thought about what goes into the medicine you pick up? Sometimes it's not as simple as just counting out pills from some big stock bottle. Today, we're going to pull back the curtain on the hidden world of pharmaceutical compounding. This incredibly skilled process of creating medication literally from scratch.
I mean, think about it. What if you're allergic to a dye in a commercial tablet? Or what if your child needs a liquid version of a pill that only comes in one giant adult-sized dose? Or, hey, maybe you need a unique mix of ingredients that just doesn't exist off the shelf. This is exactly where the standard one-size-fits-all approach stops, and a much more personal one has to begin. So, what's the solution then? Well, it's a practice that's actually as old as medicine itself, but honestly, it's more relevant today than ever. The entire field of compounding exists for basically one reason: to create medications that are tailor-made for the unique needs of one specific patient, you. At its heart, compounding is both an art and a science. It's what pharmacists do when a mass-produced drug just isn't the right fit for somebody. This isn't just about convenience. This is true personalization in medicine. But when you're creating a one-of-a-kind medicine, you can't just rely on a factory's quality control, right? Safety is absolutely everything, and there is zero room for error. That's why every single compounding pharmacist operates from a master set of rules, a totally non-negotiable safety rulebook. And that rulebook has a name: USP General Chapter 795. Now, just so we're clear, this is not just a set of friendly suggestions or best practices. Nope. These are the enforceable minimum requirements for any non-sterile compounding. It is the law of the lab. And what's really clear when you look at this timeline is that these standards aren't just some old dusty rules set in stone. They are constantly evolving. From their official start way back in 2004 to the latest huge update in 2023, they've been continuously refined to protect patients. We're talking nearly 2 decades of learning and improving. The language inside this rulebook is incredibly precise. When the text says shall or must, that's an absolute requirement. No ifs, ands, or buts. Should is a strong recommendation, but in the real world, it's treated with pretty much the same seriousness. In this line of work, the difference between must and should could literally be a matter of patient safety. Every single word matters. Okay, so with that rulebook burned into their minds, let's step inside the lab and see how these raw ingredients actually become medicine. This is where all that theory ends, and science meets some serious hands-on skill. This is where precision is king. Everything, and I mean absolutely everything, in compounding is built on a foundation of accuracy. And it all starts with the most basic tool, the balance, or the scale. If that thing isn't perfectly level, the weight is going to be wrong, and that means the dose will be wrong. It's that simple, and it's that critical. And just to give you a sense of the kind of precision we're talking about, the least weighable quantity in the teaching lab is just 20 milligrams. That's about the weight of a single grain of rice. Can you imagine the focus it takes to work with ingredients at that tiny scale? So once the ingredients are weighed out, they have to be prepared. The first core technique is called trituration. The easiest way to think about it is like a chef using a mortar and pestle to grind spices into a super fine, consistent powder. It's the exact same idea. You're breaking down particles to make sure they mix together perfectly. Next up, you've got levigation. This is what you do when you need to mix a solid powder into a liquid or an ointment. You mix the powder with just a tiny bit of a liquid like glycerin to make this smooth, fine paste. This step is what prevents a gritty texture in the final cream or lotion. Nobody wants that. But here's a puzzle. How do you make sure a teeny tiny but powerful amount of an active drug gets perfectly mixed into a much larger amount of filler? Well, the answer is this really clever technique called geometric dilution. You start with your smallest ingredient, you add an equal amount of the bigger one, mix it thoroughly, and then you just keep repeating that, doubling the volume each time until it's all blended. It's a methodical process that guarantees perfect distribution. Okay, let's see how all this comes together in a real-world example. Here's a quick look at how a pharmacist would make a liquid amoxicillin suspension for, say, a child. First, you calculate and weigh the exact amount of drug powder. Then you use levigation to create a smooth paste with a little bit of carry syrup. You transfer that paste to the final bottle, carefully rinsing the mortar to make sure not a single speck of the drug is left behind, and then you add syrup up to the final volume. It's a meticulous, step-by-step process. But making the product? That's only half the battle. Now comes one of the most critical phases: quality assurance. The pharmacist becomes the final inspector, making sure the product is absolutely perfect before it ever leaves the lab. And the stakes can be incredibly high. Just look at this. This is a real instruction from a compounding record for a light-sensitive ingredient. Warning and special consideration: no light, shut off all lights in hood. It's a pretty dramatic reminder that some ingredients are so fragile that even a moment of light exposure can destroy the entire batch.
Every single product they make goes through this rigorous checklist. Is the final weight correct? Is the color right? Are there any little particles floating around in the solution? Is the container sealed properly? And finally, there's a quality they call elegance. Basically, does it look like a professional, high-quality medical product?
But maybe the most important quality check isn't written on any list. It's a question that's asked of every single pharmacy student, and it really gets to the heart of their responsibility. Would you dispense this to someone in your family or your friends? It just completely transforms the task from a lab exercise into a profound personal responsibility. And if you're wondering just how critical this hands-on skill is, just look at the grading. In a typical compounding course, a staggering 90% of the final grade comes directly from lab work: the midterm, the final, and all the weekly prescriptions. You can't just know the theory. You have to be able to perform the craft flawlessly, time and time again.
All right, so the product has been made, it's passed every single inspection, but the pharmacist's job isn't done yet. Not until one final crucial step is complete: making sure you, the patient, know exactly how to use this custom medicine safely and effectively. The label is the final safeguard. It has to be absolutely perfect, containing everything from your name and the drug's strength to crystal clear directions for use, plus any special warnings like take with food or refrigerate.
Pharmacists are also expert translators. They take a doctor's shorthand, which is pretty much its own language of Latin roots and abbreviations, and they turn it into plain, simple English. So something like 1-GTTOD X7D becomes instill 1 drop into the right eye once a day for 7 days. This translation is absolutely vital for patient safety.
So when you really break it all down, a compounding pharmacist isn't just one thing. They have to be a master chef with a really complex recipe, a precise scientist who's obsessed with accuracy, and a diligent safety inspector with this profound sense of duty, all rolled into one person. It's this incredible combination of art, science, and just unwavering care. So the next time you pick up a prescription, especially one that looks a little different, maybe you'll think about the amazing hidden journey it took to get from a bunch of powders on a scale to the custom medicine in your hands.